So, nakakatuwa. So, small group lang tayo ngayon, although I was expecting na marami. So, magkakwentuhan tayo ngayon and very jam-pack yung ating pag-uusapan ngayon about weight management. So, for house rule, please mute your microphone so that there will be no overlapping ng sounds. And kung may mga questions kayo, pakisulat or paki-type dun sa chat box natin. And then there will be yung portion ng Q&A after the lecture. And in case meron palang, because very challenging ang ating internet connection, kung meron mang ma-disconnect, just log back in. And in case ako naman ang mag-disconnect, I will try my best to go back as soon as I can and mag-log in lang kayo. Tatapusin natin tong seminar na to. Okay? So let me just start sharing my PowerPoint presentation here. Ayan. Nakikita ba na lahat? Okay, thank you, Pam. Okay. So welcome everyone sa ating weight loss basics seminar. And I am happy that you have given time in attending this seminar. And also, I would like to congratulate everyone for choosing to equip yourself about health and wellness, because napakagandang investment is yung investment natin sa ating sarili. So this weight loss basic seminar is just ano lang siya. So part 1 siya ng series I created on how to manage your weight and how and know how to keep a healthy weight. So 4 series siya for this month of September. So today we will be discussing about weight loss basic, and next week secret to weight loss, yung anthropometric measurement. So hindi lamang yung about yung weighing sa weighing scale, yung to check if we are obese or not, if we are in a healthy range ng timbang natin. So there are different anthropometric measurement na tinatawag. So malalaman nyo yon next week. So at ano yung ano nun? What are these measurements and why do we need to know them? And how to work out your individual energy requirements based sa mga measurements na to. And on September 19, we will discuss about healthy eating guidelines. So very important tong topic na to kasi application na to about paano natin makikip yung weight natin or maglulose tayo ng weight based doon sa mga pagkain na ating kinakain. And September 26 naman is understanding weight loss and fad diets. Ito yung ano, 'di ba? So maraming fad diets ngayon. So effective nga ba sila? Or we will also discuss how body stores fat and ano yung different fat diets and healthy approach to weight loss. So meron mga trying to log in pero mahina daw yung kanilang internet. Sayang. Okay. So weight loss basic. So today we will be exploring ano nga ba ang weight loss and paano yung nagre-response yung body natin sa mga pagkain kinakain natin and ano yung mga mechanism. And we will also learn if it's weight loss is greater than eat less and move more. Totoo ba to? So before I proceed, did you know that there is a subset of people who are known as the metabolically healthy obese and have good insulin sensitivity and an absence of diabetes, dyslipidemia, and hypertension? So ibig sabihin, may population pala ng mga overweight and obese, but they don't have this underlying diseases like diabetes, like yung mataas yung cholesterol or hypertensive, but ano lang to, but itong grupo na to, they are hindi to yung something na gagawin nating basehan. So, hindi natin pwedeng sabihin, uy, may kakilala naman ako na she's obese and overweight, pero she's healthy naman, wala naman sakit. So, pwede rin mangyari sa akin yon. So, hindi pwedeng ganun yun. Exception to the rule ang mga grupong ito. So, before I continue, I forgot to, to introduce myself. And I know every one of you knows me. So my name is Lori Lee, and I am your medical nutritionist and physical therapist and your educator for today. Okay. So our objectives for today's lecture. So we will discuss what is obesity and the scope the size of the problem. We will also study what is fat. So we will understand what is fat, the diseases associated with excessive weight, factors that affect weight loss. We will also discuss energy restriction. So how important energy restriction in losing weight. Practical methods to reduce energy density. How to ensure success, kasi maraming nagda-diet but magaling lang, 'di ba? Karamihan tayo kasama na ako diyan, yung parang ang galing sa umpisa pero hindi natatapos. And combat the weight loss plateau, kasi parang pag wala na tayong nakikitang changes, ano yung pwedeng nating gawin para hindi tayo ma-demotivate or we still continue to pursue yung weight loss nating goals. Okay. So we need to obesity or overweight. A World Health Organization defines it as an abnormal or excessive fat accumulation that presents a risk to health. Okay, sandali. I'll check lang kung merong ano. Ayan. Okay. So this is there is a balance between food consumed and physical activity kapag may overweight or obese tayo. And weight loss and weight management, hindi siya simpleng paraan or process. It's a complex process and related siya. Malaking bagay, malaking kinalaman yung lifestyle natin, environment, and even our genes. We will discuss further about this mamaya. And there's no single theory explains all these manifestations. So obesity rates worldwide ay skyrocketed, yung sobrang taas ng ano niya, sobrang since 1975, it has nearly tripled. So sobrang tumataas ang rate ng obesity natin ngayon. But ang main issue ngayon, kapag obese ka or overweight ka, it's not the cosmetic side of it. Ang pinaka-concern dito is yung health, because there are what we call lifestyle diseases associated with obesity. Okay, sandali lang, meron nagpapasok. Okay. So let's discuss total body fat. Kasi when we lose weight, di ba, we are hoping na it is fat that we are losing. So let's study what is body fat and what is total body fat. Dali lang ha, meron daw kasing hindi makapasok. Okay. So total body fat is equal to essential fat and plus the storage fat. And this is presented as a percentage of your total body weight. So hindi ibig sabihin that you are obese or you are overweight. It means that you have excess body fat alone. More fat is equal to more muscle as well. And this is to support the burden of excess adipose tissue. Siyempre, mas mabigat ang body parts mo. So pagka mataba tayo, mas mabigat ang legs mo, mas mabigat ang mga extremities mo. So more muscles required to move your body. So with this concept in mind, kapag naglo-lose tayo ng weight when we are obese and we lose weight, it's not only the fat that we are losing. We are also losing muscle, but this is a normal process. So what is essential fat? So, di ba yung total body fat is essential fat plus the storage fat. So let's discuss what is essential fat. So essential fat, these are the fat necessary for our to function yung body natin. And these fats are found in our bone marrow, heart, lung, liver, spleen, kidneys, muscle, and nervous system. So how much fat is essential? It differs between men and women. So sa men, 3% ang essential fat. Yun ang a normal range. But with women, it is 4 times higher than men at 12%. Why? Because it support the reproduction, di ba? Kasi tayong mga babae, we have breast, we have yung mas marami tayong fat sa legs. Ito yung ngayon yung includes fat in breast, pelvic region, and thighs to support reproduction. So yung storage fat naman, all fat other than yung essential fat, they are called storage fat. This fat is for energy reserve and they are expendable. So nagagamit natin siya. And this fat accumulates under your skin. So we call them subcutaneous fat and around your internal organs, or what we call visceral fat. Okay, so let's discuss body composition. So in order for us to understand our weight as a whole, we need to understand our body composition. Kasi when we weigh sa weighing scale, it doesn't mean na tumataba tayo dahil sa fat alone. Maaring mabigat tayo, sometimes mabigat tayo pero we're not eating naman. Maybe because nag-exercise pala tayo and we're developing muscles. Sometimes naman, it's pure of water lang. So may body composition tayo na tinatawag. And this body composition is used with other tools, with other measurements to see the general picture of our health. So, and we need to differentiate between fat mass, muscle mass, and bone mass. So, kung aware kayo ngayon, di ba may mga bathroom weighing scale, mga digital that also display your fat composition, muscle fat percentage, muscle percentage, water sa katawan. So I have that weighing scale. So it's very useful, no, para makita natin kung excess na ba yung body fat natin or we are losing weight because of dehydrated ba tayo. So meron ng ganun yon. And kapag naintindihan natin, mas magiging aware tayo paano natin i-manage ang ating weight. So, and the one reason then kung bakit kailangan nating i-differentiate ang mga itong fat mass, muscle mass, and bone mass, kasi yung BMI, what we call yung body mass index na tinatawag natin ngayon, na ginagamit to gauge kung nasaan ka ba, kung normal weight, obese ka ba, or underweight ka ba, it's not it's not really accurate, or reliable na isang siya lang, sole reliable na measurement para makita natin kung ang weight ba natin is healthy or not. For example, yung mga weightlifters, di ba, mga athletes, pwede silang, kung BMI alone, they can be categorized sa overweight. Kasi mas bulky yung kanilang muscle, mas mabigat. But it doesn't mean na mabigat sila is marami silang fat sa katawan. So hindi reliable ang BMI for this kind of case. Another example is yung mga older adults, yung mga seniors. As we grow old kasi, ang ating bones ay numinipis, mas gumagaan. And yung lean muscle mass din natin is pumapayat din tayo. So, for example, there are two people, isa is senior, isa is bata pa, same height, same weight, but their body composition differs. Okay, so that is the reason why we need to know about our body composition. Okay, there are also other tools that we can use to know about our body composition. We have what we call the BIA or bioelectrical impedance analysis. And we can also use yung skin folds caliper, dual X-ray absorptiometry, and air displacement plethysmogram. Ano na to? Medyo ano na to yung high-end machines na to. But what we can use is yung skin fold and the BIA in calculating our body fat. So in this example, this is a caliper. So it measures the skin fold, the subcutaneous fat. So, but this one, kailangan to ng precision. So you must be well trained in using this for you to get the accurate measurement of your body fat. And there are certain areas na pinagagamitan niya. Example, one of the areas, itong nasa picture is the biceps. Yung sa likod niyan ay yung triceps, and dun sa likod natin, pwede rin i-measure kasi ano yun pwedeng ang tawag dito, i-pinch yung skin natin doon and pwede nating i-measure. But ano siya, yung inaccuracy niya is very high kasi depending nga siya sa skill ng gumagamit. So, kailangan kapag ginamit mo to is well-trained ka in using this tool. So what I use is the bioelectrical impedance analysis. So may weighing scale ako that tells yung body composition. So katulad dito sa picture na to. Okay, so, ito. Ito tong weighing scale na to. So ito, yung machine na to, itong BIA pala is based on the principle that relative to water, muscle is ano siya, highly more ano siya, muscle conducts more electricity than and low impedance than fat. So this machine, the BIA, is measure your body composition analysis ng mas madali. And it's non-invasive. So, hindi mo kailangan ipisilin yung fat mo or anything na gawin mo pa sa katawan mo, tatayo ka lang dun sa machine. So, dahil nga mas conductive yung electricity, ang muscle kesa sa fat, so nagigauge ng machine, no? Because mas maraming electrolyte content ang muscle. So nagigauge ng machine ang fat content mo, ang muscle content mo, ang bone mass percentage ng katawan mo. So it is good to use to get the fat pre-mass sa katawan natin and the fat mass. So meron lang downside of using this machine kasi if you are dehydrated, kasi nga 'di ba yung water as a means of conduction na dahil sa machine na to, no, kapag dehydrated ka and kung ikaw ay puyat din and uminom ka ng mga diuretics na gamot, magiging inaccurate yung reading ng machine. Ma-overestimate niya itong fat mo or muscle mass analysis mo. Okay, so ibig sabihin, meron din siyang weakness. But ang pinakamaganda lang dito, kapag meron kang machine na ganito, make sure na you create the same situation. Halimbawa, every morning ka, upon waking up, every morning ka nag-weigh. So, the next time you will weigh yourself, the same din. Hindi the different time of the day. Kasi kung halimbawa nag-weigh,
Justin.
kung nag-ano ka, for example, nag-weigh ka ng morning, tapos the following day or the next time na mag-weigh ka sa evening na, iba na yung iba na yung fluid sa katawan natin. So make sure if you have this one at home, same time ka and make sure na hindi ka dehydrated, well hydrated para rin accurate ang mga readings. Okay. So let's study what is normal body fat. Now we know that okay. Now we know that body fat composed of essential and the storage fat. Ano ba yung normal percentage niya? Kasi ang binibigay ng BIA machine is the total body fat. So kapag sa men, it should be around 18 to 24%. So beyond that, nasa overweight category ka na. Sa women, syempre mas mataas, 25 to 31%. Okay, so now that we studied meron palang essential fat and storage fat, let us study naman ano ba tong fat cell na to. So yung fat cell also known as the adipose cells. And kapag mature fat cell na, ang tawag sa kanya is adipocyte. So this is the medical term for fat cell. And there are two things that happen to our fat cell. Pwede siyang dumami in numbers na tinatawag nating hyperplasia. So this is a part of a normal process of growing up. And this is faster in obese children. So accelerated ang pagdami ng body fats kapag mataba ang bata. This is very important to know, no? Kasi there is a study na kapag ka lumagpas ang, bawa may kilala tayong obese child, no? Na, ang age niya is younger than 8 years old, no? We should parang ano natin nun, ipa-diet na natin ng batang yon. Why? Kasi they have found out na kapag ka lumagpas ka na sa age 8 years old, tapos ganun yung obese yung bata or overweight siya, madadala niya na yon sa paglaki at mahihirapan na siyang magpapayat. So mas magandang bata pa lang. This is the reason why it's important to teach our children, ang ating mga kamag-anak, mga pamangkin, apo, anak, na train them na piliin ang healthy food and train them sa healthy diet. Kasi magiging setup na to ng nila, ng pagtaba nila when they get older. So another thing that that happened to our fat cell is increased size of the cell. So tumataba din sila. Ang tawag naman dito ay hypertrophy. Yung isa dumadami ang number ng fat cell. Ito naman mismong yung fat cell mo nag-i-increase yung size nila. So based sa research, no, kapag pumapayat pala tayo, hindi nababawasan ang fat cell sa katawan natin. This is important to know. Ang nangyayari pala, consistent to sa mga research, pumapayat lang din ang ating fat cell. Kasi, why this is important to know? In order for us to see a significant decrease in the size of our fat cells, we have to lose at least 5% of our body weight. At least 5%. Okay? So yung fat cell natin, let's study fat cell. Yung fat cell pala natin can expand as much as 1,000 times. So kahit pala konti lang yung, hindi ganun kadami yung fat cell mo, Pero kung sobra kang kumain, pwede silang mag-expand up to 1,000 times. Imagine that. And kaya this is the reason why, kasi once they expand, yung ating skin also mag-expand. As long as there is a space for fat cell na mag-expand, mag-expand yan. So, kaya karamihan lumalaki yung ating torso kasi mas maraming area para mag-expand ang ating fat cell. Unfortunately, kasi kapag nag-lose tayo ng weight, lalo na kung mabilis ang pag-lose ng weight, yung hindi nakakasabay, yung na-stretch na skin. That's why for some people na nag-lose ng significant amount of weight, they need to undergo surgery for skin removal. That's why kapag tumaba tayo at pumayat, nagkakaroon tayo ng mga yung parang yung saging ng skin because of this reason. Okay. So let's study naman ano ang mga types of fat cell. We have what we call white fat cell and or white fat tissue, and this fat tissue is found all over our body. And purpose niya is to store energy, also for cushion, para for protection ng internal organs natin and yung mga structure inside our body, and also to insulate, no? Para to regulate body temperature inside our body. But white fat kapag tiningnan natin siya, it's not really white. It's yellowish in color because of the carotene sa ating mga kinakain. So, yung carotene, kapag meron tayong carotene-rich diet, mahilig tayo sa papaya, sa mga carrots, o sa mga yellow foods and fruits and vegetables, ang ating fat cell, ating white fat is more of yellow in color. Okay. And another type naman ng ating fat tissue is the brown fat. This one naman, common to sa mga infants. So kapag ka baby pa lang, sanggol pa lang, marami silang brown fat. So but in some adults, we also have brown fat. Ang pinagkaiba niya sa white fat, this brown fat has it has more of mitochondria, yung pinaka-powerhouse ng ating cell. So dun yung energy production. Kaya siya brown because of the mitochondria content niya. So ang marami itong brown fat, matatagpuan siya sa ating likod, itong scapular and subscapular, parang yung bone natin dito sa likuran. So yun. Ang function niya is to help with energy expenditure. Kaya marami siya sa mga bata kasi 'di ba, yung growth ng bata mas mabilis. Mabilis ang growth ng cell growth ng mga bata. And yung also function niya is to regulate body temperature by regulating heat. Pero once na tumanda na tayo, some of the brown fat, nawawala yung mga mitochondria and becomes white fat as we age. Okay. So practical way of one way of measuring ang ating kung ang weight ba natin ay nasa healthy range is by calculating your BMI. As I mentioned earlier, BMI stands for body mass index. And how to calculate this? Just get your weight in kilogram, i-divide mo lang siya ng height by meter squared. Or kapag pounds naman yung weight mo, i-divide mo siya ng inches squared and i-times mo sa 703. So this will be discussed further dun sa anthropometric measurements. But sinali ko lang siya dito so that you will have an idea. Kung makuha mo na yung result, if your result falls between 25 to 29.9, you are considered overweight. Kapag naman nasa 32, 34.9, obese class 1. Kapag 35 to 39.9, nasa obese class 2 na. And greater than 40, obese class 3 na siya. Okay, so question, have you calculated your BMI before? Just give me a thumbs up kung nagawa nyo na to. At nakita nyo, diba? Uy, nasa healthy range ako. Okay, so walang nag-thumbs up, so wala pang gumawa. So i-try nyo to kasi malalaman nyo, uy, healthy ba ang weight ko or hindi. Okay, so let's study naman the visceral fat. So I already mentioned earlier that di ba, when we have fat around our waist, they are called, or yung supports na yung mga fats sa organs natin sa ating abdominal area, they are called visceral fat. Kapag marami kang fat around your torso, colloquially tinatawag yon na apple-shaped body like this one. So this is important to note then kasi apple-shaped body is has a negative impact sa health natin. So this visceral fat is unsightly fat found in the abdominal area or belly fat. More common siya sa men. And the reason why bad siya sa health natin because this visceral fat secretes inflammatory markers. Itong inflammatory markers na to, they are the one that cause us to, predisposed us to different lifestyle diseases. Why? They have found out pala sa katawan natin, lahat ng toxins na pumapasok sa katawan natin, na i-inhale natin, kinakain natin, lahat ng preservatives, lahat ng dun sa mga ini-spray sa food natin, lahat ng mga chemicals na yan, they become toxins sa body natin. And sometimes yung body natin is not capable of removing these toxins, no? Kaya yung mga toxins na to, they are deposited sa mga visceral fat. So remember that. Kaya mas malaki ang fat mo sa katawan, lalo sa abdominal area, mas high yung risk mo developing different kinds of lifestyle diseases. So higher risk ka kapag marami kang visceral fat, twice yung mortality compared to dun sa normal yung kanilang waist circumference. And also you are at risk of insulin resistance and diabetes. You are also exposed or predisposed to have a coronary artery disease or heart disease, dyslipidemia, no, abnormality sa level ng cholesterol natin, hypertension, stroke, and metabolic syndrome. Okay, so now that we know na kailangan nating paliitin tong visceral fat natin, one way of checking our visceral fat is to calculate our waist circumference. So paano yan? Simple lang. I-measure lang natin yung waist natin. And kapag ang result natin is greater than 40 inches for men, ibig sabihin marami kang visceral fat. And sa babae naman, if it's greater than 35 inches or 88 centimeter for women, yun din. So ibig sabihin, yung risk mo to get this lifestyle diseases is mataas. So pwede natin tong gawin. And take note of this values. Okay, so let's discuss naman itong pear-shaped body weight. Pear-shaped body weight is like this one. So yung meron tayong tinatawag na gynecoid fat. Yung fat is more on our buttocks and sa thigh area. So sinasabi nila mas healthier ang gynecoid fat than yung visceral fat. Kaya mas healthier daw or mas good yung yung pear-shaped than yung apple-shaped. Okay. So gynecoid fat is excess gluteofemoral fat meaning ng gluteal, yung buttocks, yung femoral is ang ating thigh. Kaya tawag siya gynoid fat or gluteofemoral fat. This type of body shape is more common in women during childbearing years. So normal talaga sa mga babae na lumalaki ang ating hips, no? Kung sexy tayo ng mga single, at kapag nanganak na tayo, hindi na natin maibalik yung ating figure because of this fat. So gynecoid fat utilized to support the demands of pregnancy and lactation. But kapag ka nasa postmenopausal naman na tayo, itong mga fat mas nagde-develop tayo. Women develop more visceral fat na. Okay. So paano natin malalaman kung yung ating fat sa ating hips ay nasa within normal range. So meron tayong tinatawag na waist to hip ratio. So kukunin natin yung circumference ng ating hip and ang ating waist. And i-divide natin. So yung waist na pwede natin gamitin centimeter or inches. And i-divide natin yung waist value na yung circumference natin divided by the hip. So kapag ka nasa mas mataas ka sa 0.9 for men, ibig sabihin marami kang fat sa katawan. Sa women naman, it's 0.85 for women. So dapat hindi tayo lalagpas sa range na yan. Another way naman is your waist to height ratio. So kunin mo lang yung height mo and kunin mo yung waist circumference mo. So yung waist divided by the height, ang normal niya is dapat less than 0.53 for men. Kasi greater than that, ibig sabihin marami kang excess fat sa katawan. And for women naman, it's 0.49. Okay, so question. Now that we have discussed what is apple and pear shape, are you an apple or pear shape? Okay. So now you know, nasa healthy ka ba, healthy side, or nasa unhealthy side? Or predisposed ka ba sa mga lifestyle diseases or not? Okay. So let's move on. Fun facts. Excess intake of any nutrient is converted to adipose tissue through the process of lipogenesis. Anong ibig sabihin nito? Kasi 'di ba may mga notion tayo, ay hindi ko kakainin tong food na to kasi fattening to. Hindi ako kakain nitong certain food na to kasi tataba ako. But in reality, any excess intake, nagiging din siya, nako-convert din siya sa fat natin kahit protein pa yan, kahit carbohydrates pa yan, magiging fat pa rin yan kasi kapag excess at hindi nagagamit. So bear in mind about this fact, no? Kaya ang sikreto pa rin, well-balanced diet. Okay? Itong lipogenesis, ginagawa siya ng liver natin. Nagpo-produce talaga ang liver natin ng fat kasi nga may natawag tayong essential fat. So kasi wala tayong it's not something na pwedeng ilabas ng katawan natin ng mga excess na kinakain natin. So na-deposit talaga siya as fat sa katawan.